The Honourable Leader of the Official Opposition.
Thank you so much, Mr. Speaker. Like many members of this House, I chose to live in rural Prince Edward Island because of the tranquility and the charm, as well as the strong sense of community that exists in every single little island town and village from tip to tip. Much of what keeps our rural communities dynamic is provided by the people who choose to live there. But for our rural communities to remain strong and vibrant, they also require a basic set of services which everybody who lives in the developed world has come to expect. Among those basic services is access to healthcare. There has been a doctor in Crapo since the late 1800s, and the South Shore region has been well served by a succession of physicians ever since then, right up until a couple of years ago when Dr. Giordani, who took over the office of longtime practitioner Dr. Visser, left so very suddenly. As soon as the community became aware of the loss, they created a committee which remains active to this day, advocating nobly on behalf of the South Shore region. The election this spring led to promises of a full-time physician and multiple nurse practitioners to be in place shortly after the votes were counted. But as I stand here today in this House, the region of approximately 8,000 people and a patient base of 2,300 attached to Dr. Visser's office still do not have a doctor in place. What we do have is one nurse practitioner who is much loved by those who see her, and she's providing wonderful care. The problem is that Jennifer Wood has quickly become overwhelmed by the demands for her services. And if you call for an appointment today, you'll have to wait approximately 4 weeks before you see her. There was a second nurse practitioner hired the same time that Jennifer was, but she was deployed to Cornwall, a drive of between 15 and 30 minutes, depending on which part of the South Shore region you live. This second nurse practitioner is currently underutilised, and for those willing and able to travel, appointments are available almost immediately. The problem is that patients are reluctant to go to Cornwall for an appointment because their patient files are transferred to that office where they remain, therefore committing you to continued travelling to Cornwall for all future medical appointments. People in the South Shore area want more sensible distribution of the nurse practitioners in order to reduce wait times and the necessity for travel. And I look forward to government acting on this very soon. It would also be nice, of course, to have a reliable electronic medical records system here so that PEI's files can be shared between offices, but I guess that will have to wait for another member statement. Thank you very much, Mr. Speaker.